Thank you for taking the time out of your day to sit down with me, Dr. Buck. We really appreciate it. Can you tell me a little bit about yourself?
Well, I grew up on a small farm in Indiana, and I decided to become a pharmacist when I was a freshman in high school. I went to Purdue University. It was the only big state school that offered pharmacy in Indiana, and got very lucky because I really loved it and I had a great time there, and still consider many of my professors and preceptors there mentors and friends. I also met my husband when I was a student at Purdue, and we have 2 sons who are in college now.
Can you describe your specialty field of pharmacy?
Oh, certainly. My specialty field of pharmacy is pediatric clinical pharmacy. And I decided on that specialty, or became first interested in that specialty when I was a student. I had the opportunity to take an elective class in pediatrics and loved it. And at that point, I knew that's really what I was interested in pursuing. As a student, I had the opportunity to take 2 pediatric rotations. I would have to say, though, I really think a diverse group of rotations is important. And it's good to have rotations in your area of interest, but I think I learned as much from those other rotations, the other requirements that I did and other electives. And I still tell my own students and residents that I think it's a good idea to get a very broad background. I learned something from each one of my rotations that I've built into the kind of preceptor and practitioner that I am now, because I really feel like every rotation gives you something that you're going to learn from.
What residencies have you completed, and can you describe your experience?
I completed a pediatric residency and a fellowship at the Medical University of South Carolina. Spent a year of very broad pediatric rotations, and then did a year of fellowship that involved teaching and research.
Okay. What do you like most about your job?
I think the thing I like most about my job is the interdisciplinary rounding aspect. I work in the pediatric intensive care unit at UVA. We have a very collaborative team that's made up of physicians, nursing, respiratory therapists, of course pharmacists, nutritionists, and I have the chance every day to be involved in the decision-making process for the patients. And not only contributing to patient care, but I'm also teaching in the moment. I'm teaching medical students and residents, as well as my own pharmacy students and pharmacy residents. And everyone has the opportunity to provide input. I think teaching in the actual patient care setting is really valuable for learning how to be a clinical practitioner.
What advice would you give a pharmacy student who wants to pursue a career in your field?
The best advice to students who want to go into pediatrics is to really decide if that's your passion. So a lot of people think, well, you just have to love children. Well, that's a part of it, but it's really more than that. You have to like the science. So if you will sign up for the table of contents for several pediatric journals like Pediatrics, Journal of Pediatrics, Journal of Pediatric Pharmacology and Therapeutics are great choices. And give yourself about 6 months of getting those table of contents, look through those, and pick 2 or 3 articles to read. If you find yourself at the end of 6 months still really looking forward to that time and able to build in that time on top of all your other responsibilities as a student, that's a really good sign that this is your passion. If you've kind of given up on it after a couple of months and it seems like a burden, then maybe it's not what you really are most interested in.
And now you've mentioned your connection with ACCP. How has ACCP helped you?
Oh, how has ACCP helped me? That would be a long answer, but I'll try to keep it really short. As a resident, when I joined, it was the opportunity to see a very high level of practice. And I've done lots of different things within the organization. As soon as I joined, I started to volunteer for things. And early in my clinical practice was reviewing abstracts for meetings, reviewing articles for pharmacotherapy, and started volunteering through that annual survey that comes out each year to serve on committees. I also was very involved, and still am, in the Pediatrics Practice and Research Network, and served as chair for that. and then eventually ran for office for the Board of Regents, and then finally ran again for president. And I'm really happy to serve as president of ACCP. It's been a wonderful chance to network with people in my specialty, but also to meet people in other areas that I wouldn't have otherwise gotten to know. It's been really fun, and I have learned a tremendous amount.
Again, thank you for taking the time out of your day to sit down and talk with me. Would you be willing to be contacted by students if they have any further questions for you?
I would be delighted for students to contact me to talk more about ACCP or about a clinical career, not just in pediatrics, but sort of in getting your career started. My contact information is in the membership directory, and certainly I would love to have a chance as president to talk to as many members as possible.
Again, thank you for taking the time out of your day.